Hello, everyone. Welcome to our educational breastfeeding webinar. We are Black, we are beautiful, and we are breastfeeding. And that is the name of our event tonight. I am Dr. Chelsea Cosby Morgan, and I'm pleased to present this event to you in collaboration with the National Medical Association Women's Health Section. A big thank you to Dr. Sherry Broadwater, who is the lead of the Women's Health Section. If you don't know about the National Medical Association, it is the largest organization in this country representing African American physicians and the patients that we serve. So big thank you to the NMA. First, we're going to do a little bit of housekeeping. This is an educational program and is not intended to be a substitute for medical advice, diagnosis, or treatment. The professionals participating in this event are representing their own personal views and not those of their employers. And finally, this webinar will be recorded and shared with the registered attendees when it is available. Feel free to share this Facebook Live link, but if you would like to receive the recording, make sure you are registered. Through this presentation, you will be able to list at least 3 health benefits of breastfeeding, describe barriers that disproportionately impact Black women, and identify virtual and community-based solutions for breastfeeding barriers. We have 2 parts to our agenda today. Part 1, we are going to talk about breastfeeding facts that you can use, why breast milk is the best milk, and part 2, we're going to have a panel of health experts, and it's going to be starring breastfeeding moms. So before we get started, I just want to introduce myself again. I'm Dr. Chelsea Cosby Morgan. I'm a family medicine physician, and that's a physician that is a primary care doctor, but also has training in pediatrics and low-risk pregnancy deliveries. So as a family medicine physician, I specialize in women's health care. And today, I'm not going to be here in my official capacity, which is the Deputy Director of Comprehensive Health in the VA's National Office of Women's Health, but I'm here on my own to bring you this information. So we're going to go ahead and get started. Breastfeeding while Black is a very sensitive subject. We know that for centuries, our community and our culture has been under attack. During the time when our ancestors were enslaved, a lot of women had to serve as wet nurses. So before we could take care of our own children, before we could even take care of ourselves, we had to nurse other people's children, even if we were eating scraps. So once we were able to leave slavery, a lot of people were not able to continue breastfeeding. That's because we moved into cities, we had to go to factories to work or be domestic workers, and we were immediately taken out of the home. A lot of us depended on cow's milk, other animal milk, or formula once that was invented. Once doctors realized that formula was not as good as breast milk, the Black community didn't necessarily embrace that. And part of that was because we still had to be outside of the home to work. Now that we know that breast milk is better than formula, we want to make sure that we can share this message with everyone. We do have traumas attached to it, but it's time for us to reframe our traumas and put our health first. A lot of people say, well, I was on formula and I'm fine. Well, we don't want our next generation to be fine. We want them to thrive. We're in a new environment full of plastics and full of chemicals, even in the rainwater. So we need to set our next generation up to thrive. Let's talk about the numbers. So the CDC has a national immunization survey that they do every year. And it's not just about immunizations. They also collect information about breastfeeding, among other topics. So as you can see in this graph, we have several lines, and each line represents people of different ethnicities. So the top line, that green line, represents Asian babies. The yellow line is the next line, represents white babies. The orange line represents Hispanic babies, and that blue line on the bottom represents Black babies. All the way to the left, you can see that Asian babies were babies that were ever breastfeeding at 92%. Babies that were ever breastfeeding that were Black were at 79%, all the way at the bottom. As babies continued during their life, at 6 months, they recorded that with that middle dot, and then all the way to the right, that is babies that were still breastfeeding at 12 months. Now, this includes babies that were breastfeeding and maybe were eating other foods, drinking juices, or drinking milk or water, but they were still consuming breast milk. So for the Asian population, that was 51% of their babies. And for the Black population, that's 27% of our babies were consuming any form of breast milk at 12 months. To take that one step further, if we look at babies that were exclusively breastfeeding, so this means they're not taking in any other forms of food or nutrition, they're only taking in breast milk. So at 3 months, we can see that Asian babies were at 50%, Hispanic babies at 42%, white babies at 50%, and Black babies at 39%. I do want to point out that the CDC did not have sufficient data on Native American or Pacific Island babies. So as you see, there's a huge gap here. And later on during this event, we're going to talk about why it's important to breastfeed, because that would explain why this gap is an issue. So why do fewer Black women breastfeed? According to the CDC, they let us know that a lack of knowledge about breastfeeding is one issue, and we hope to address that today. The lack of peer, family, and social support is also an issue. That's why it's so important that people are joining this event, even if you are not a breastfeeding mom. This information is important to you because we are a community, we're a village, and people depend on their elders, their siblings to help them through these tough times. Also, insufficient education and support from healthcare settings and concerns about navigating breastfeeding and employment. Now, I want to talk about that last one a little more. So when we talk about employment, we have to recognize that working moms are not paid equally. This graph is from the Department of Labor, and at the top, at the 100 or the $1, that is the earnings of a non-Hispanic white male. And as you can see, Asian women, white women, Black women, Native American women, and Hispanic women all make far less. Black women at about 63 cents on the dollar. And if we control for the education, we can see that that dollar amount is still different. So if you were to take a white male with the same degree as a female, a Black female of the same degree, you can see these wage differences. So if someone had a bachelor's degree, they would make 65 cents compared to a white male with a bachelor's degree on his dollar. The reason this is important is because we have to return to work. Because we don't have equal pay, we have to go back sooner, and we go back sooner than other ethnicities. The CDC actually says returning to work is often a barrier to Black women breastfeeding. If we return to work before 12 weeks postpartum, and postpartum is the time frame after you deliver your baby, that's called postpartum. So if we return before the 12 weeks, if we are planning to work full time, which is almost all of us, or both, they say those are all risk factors for Black women not being able to exclusively breastfeed when they need to. And they also note that inflexible work hours are a part of that equation. So these are some of the sources I'm quoting, but we are going to move on to the next part. Now we're going to hear about why is breast milk the best milk? Why is it such a big deal? So I'm going to invite Dr. Cherie Squeer. She is a pediatrician, and she's going to share with us information about exactly why breast milk is the best milk.
Hello, everyone. Thank you for having me. Let's see. Can you see my slides on here? It says it's behind the scene. Do I need to do something different? Okay, there we go. Okay. All right, so we'll just go ahead and get started. So like she mentioned, I'm a general pediatrician, also a breastfeeding mom of two. So I'll just kind of go through some of the information on why we think breastfeeding is best and encouraging, hopefully things that may encourage you and help you along your journey. Can you see the slides now? Yes, okay, thank you. So first we'll start with the recommendations from professional organizations. So the American Academy of Pediatrics, the World Health Organization, UNICEF, and Academy of Breastfeeding Medicine are now finally all on the same page of how long we should be breastfeeding for. So the wording is you should do exclusive breastfeeding for at least 6 months. And what exclusive breastfeeding means is that there's only breast milk and maybe supplementation with vitamins given to your baby for the first 6 months of life. After the 6 months of life, it's mentioned that you should continue breastfeeding as complementary foods are being introduced as long as mutually desired for 2 years or beyond. The longer an infant is breastfed, the greater the protection from certain illnesses and long-term diseases. And that's for the mom and the baby. So the bottom line is there's no such thing as a baby is being breastfed too long. That is a personal decision that you can make for you and your baby. So I know a lot of people will say that baby's walking, it's too long, that baby can hold a bottle, breastfeeding's too long. That is, everybody on this page will say that you can breastfeed as long as you want, and we recommend for at least 2 years. So let's talk about some benefits. So the first thing is you have decreased risk of sudden infant death syndrome by 36% in your infant. Decreased asthma and allergies and any type of like eczema, you decrease the risk by 40% with breastfeeding. You have less complications from respiratory infections if you breastfeed. Decreased risk of overweight and obesity by 24% with breastfeeding. Decreased risk of leukemia by 15 to 20%. Decreased risk of acute otitis media or ear infections by 50%. Decreased risk of gastroenteritis or GI bugs by 64%. And you have improved outcomes for premature infants. The premature babies will have fewer infections, decreased risk of necroenterocolitis, which is a really bad gut disease, by 77%, and earlier discharge from the NICU if that baby is being breastfed. Now let's talk about some mommy benefits. There's decreased risk of postpartum hemorrhage or bleeding, faster return to your pre-pregnancy weight, so faster return for that snapback, decreased risk of type 2 diabetes, decreased risk of obesity and metabolic syndromes, delayed onset of your periods coming back and ovulation, which also allows you to have a decreased risk of iron deficiency anemia and an increase in your child spacing if you're not having ovulation. Decreased risk of postpartum depression as well, and decreased risk of developing breast, ovarian, and uterine cancer in the mom. So lots of mommy and baby benefits, but let's talk about some public health benefits. Oops. So in 2016, researchers estimated that if everyone breastfed as recommended by the World Health Organization and the American Academy of Pediatrics, it could prevent over 820 childhood deaths and 20,000 maternal deaths a year and save $300 billion annually and reduce healthcare costs and improve economic outcomes. So I know that, like we just mentioned, that would be breastfeeding for at least 2 years. Or as long as you want after that. And that would prevent all those deaths that's mentioned. But say if if 90% of the US breastfed exclusively for the first 6 months of life, that estimates 911 deaths a year would be saved, and it would prevent the economy from spending $13 billion a year. So even if we were to get to exclusive breastfeeding for 6 months of life, even though we want longer, it would save a lot of lives in our country. So let's talk about some risk factors for having difficulties with breastfeeding. I think this is really important to know because a lot of us go into motherhood and breastfeeding thinking that since it's natural, it's going to be easy peasy and shouldn't be any problems. But there might be some challenges, especially if you have any of these, if you're dealing with any of these things listed on the risk factors. So lactogenesis 2 is basically what we call mature milk. And so that's what you hear people say, my milk coming in. So if you have a delay in that, a lot of people will stop breastfeeding because they think there's something wrong with them. So when you have a delay in lactogenesis 2, that means that it took longer than 72 hours for your mature milk to come in. So with a lot of these, like a first-time breastfeeder, if you had a C-section, if you have diabetes, PCOS, hypothyroidism, maternal age above 30, if you're obese, if your baby is less than 38 weeks, or if you have a small baby that's 2.5 kilos at birth, if you received a lot of IV fluids, if you had some bleeding after delivery, if you used assisted reproductive therapy or IVF, or if you have any retained placental products, like something stayed inside of you after birth, that could cause you to have an issue with your mature milk coming in before that 72 hours. So it doesn't mean that you can't breastfeed. It just means that you have your mature milk or your milk coming in at 5 days instead of 3 days. But it's important to know that so you can expect those challenges, you can work through it, you can have lactation support earlier than later, and you can kind of plan around that. So there's other risk factors for breastfeeding failure. And the things listed here are more so about the support system, about systemic racism, about personal racism, and the demands that you have in your life in general. So being unmarried, less education, participating in the WIC program, unintended pregnancies, being African American or Black, teenage mom, poor support system, mothers with multiples, mothers with babies in the NICU, infants supplemented more than once in a 24-hour period, mothers with a breastfeeding failure, quicker return to work, or infants who have not latched effectively in the first 12 hours of life. So this again will make you have more challenges. So this is like my favorite picture to use in the nursery when I'm rounding. It's a good picture because it shows you what the newborn belly looks like at each stage of development or each age of life. So a lot of times I hear moms say, my milk is not in yet, and it's the first day of life, and they want to supplement because they don't feel like they're giving their baby enough milk. But if you see in this picture, the first day of life, the baby's belly is the size of a cherry. And I like comparing it to this milk bottle because you see that there's a few drops of milk in that bottle. And so that's the size that is needed to fill your baby's belly, which is 5 to 7 milliliters of milk, like 1 teaspoon. So you don't need a lot on the first day of life, which is a perfect match because you have a few drops of colostrum that's released every time that baby is feeding on you. By day 3, the baby's belly might be the size of a walnut. So you can get maybe 22 to 27 milliliters, which is a little less than an ounce, that will fill that baby's belly, which is, again, a perfect match because 50% of women may start having that mature milk or that more volume in their breasts by day 3. 1 week of life, you have about 1.5 to 2 ounces that will fill the baby's belly. And then 1 month and beyond, your baby's belly will be about the size of an egg, which can be 2.5 ounces to 5 ounces. So there's no need to show the belly after that because this is going to be the baby's belly size until they're basically a toddler. Every postpartum individual has colostrum, and so that production starts about 20 weeks gestation. Your milk supply will increase until about 3 to 4 weeks of life, then should be stable until complementary foods are introduced, like we said, around 6 months of age. Once those foods are introduced, milk supply gradually decreases, but that does not mean that you need to supplement with formula or anything else. It's a perfect match because the baby's getting other supplementation with like water, with foods. So then your natural production is going to decrease appropriately. A fun fact, babies should never require, again, more than 5 ounces of milk per feed if you practice appropriate pace feeding and if you pay attention to their fullness cues. That's even formula fed babies. So you see babies get more than that, but technically, if you're paying attention to the cues and pacing them, they should need more than about 5 ounces. So promoting lactation. So you should have your baby skin to skin as early and as much as possible soon after delivery. You should also do frequent latching and frequent feeds on demand at a minimum about 8 to 12 times in a day, which is about every 2 to 3 hours. You want to try to avoid pacifiers early in breastfeeding because you want to try to pay attention to your baby's feeding cues. And early on, you may not know if the baby wants to feed or if the baby just wants to suckle. So that's why we actually recommend staying away from pacifiers early on. You want to latch your baby within the first hour. There's a lot of evidence, and probably the most evidence that's the best indicator for successful breastfeeding if you latch within the first hour of life. You want to learn hand expression as soon as possible while you're in the hospital. So that's where your nurses and your lactation consultants can really help with teaching you how to do hand expression. Because early on, you're getting that colostrum, and your pumping is not going to get as much of that colostrum out. So learning hand expression is going to be really helpful. And embrace the cluster feeding. We'll talk about that, what that is in a second. So cluster feeding. So cluster feeding is this time when your baby wants lots of short feeds over a few hours. This is a very normal process. It's usually related to a growth spurt. It's going to happen early on in breastfeeding. I usually tell the moms you'll see it pretty much usually the second day of life. And the nice thing about this process, it usually happens at night when you're trying to catch a few more Z's in a busy hospital, in a busy situation. But you need to embrace it because I think of it as the time when the baby is telling your body, we really want this to happen. We want that transition of that mature milk. We're going to make this happen. So I'm going to keep feeding on you until I get that mature milk going. So if you think of it that way, you might not be as annoyed by the process because it can be tiring and it can be discouraging. It never means that your body can't do it, though. It does not mean you have low volume of milk. If that baby is acting normal, that baby is not losing a lot of weight, and you see good wet diapers and good dirty diapers, your body is doing what it needs to do. And so just trust the process and embrace the cluster feeding. So this is a very busy slide. I just want to show it, and I know it looks very small, but this is on the Academy of Breastfeeding Medicine's website, and it gives us information on when should we supplement babies. So this is actually a free resource that anybody can access on the Academy of Breastfeeding Medicine's website. It's listed as clinical protocol number 3, if anybody wants to access that or screenshot this very small table. But will be handy, say if you are, taking your baby to a provider or a physician and they may be trying to push supplementation on you. This is going to be a good resource for you to kind of look at and have shared decision-making capabilities to kind of talk back and forth of, is it really necessary at this time? So definitely use this as a resource for that. And I'm going to go through each part of it a little bit. So low sugars. So if the baby has asymptomatic hypoglycemia or asymptomatic low blood sugars, and it's not responsive to appropriate frequent feeds, you may need to start short-term supplementation with expressed breast milk or formula. Or if the baby is symptomatic with low blood sugars, the baby may need to go to the NICU and start IV glucose or IV sugar. If that happens, though, your baby can still get breastfed. Your baby can still feed from the breast if they're stable. So that does not mean that you cannot give them breast milk. It just means that they might need short-term supplementation. Signs of dehydration. So if we see that the baby has signs of dehydration and we've looked at proper feeding mechanisms with breastfeeding, and the baby still has dehydration, meaning that they have low numbers of wet diapers for their age, or we saw some blood signs like a low sodium on their blood level, or the baby just looks very lethargic or tired, we may consider supplementing for short term with formula or, again, pup breast milk. If the baby has lost a lot of weight. So what that is defined as is sometimes that's 8 to 10% of below their birth weight if you're around day 5 of life, or if you're looking at this newborn weight tool, which is called the NEWT, and they're at the 75th percentile line on day 5. We may consider supplementing. That's not an automatic go-to, but it's where your medical provider or your physician may decide to follow up more closely, making sure they're not showing signs of dehydration, making sure that they're still acting like a regular baby, a regular healthy baby. They definitely would need the baby and you to be seen by a lactation consultant and sometimes other specialists to make sure breastfeeding they don't need to change anything with the breastfeeding regimen. So this might be where they need to start supplementation. If it looks like your latch is good, it looks like the baby, can, do everything normally with breastfeeding, but they're still losing a lot of weight. Again, a short-term supplementation with formula or express breast milk may be needed in this time. The Newt is this picture right here is a really good tool that a lot of us are starting to use because it compares apples to apples. So if you are going to a provider and they're saying that your baby is losing a lot of weight, just ask them if they're using this tool because it gives you better information, like if it was a vaginal delivery with and if you're breastfeeding versus comparing your baby to babies that are formula fed. So it's better for that. Delayed stooling. So if your baby doesn't stool within the first 48 hours, or if we're still seeing that dark tarry meconium stool by day 5, there may be some need for short-term supplementation with formula or express breast milk. If your baby has what we call dehydration jaundice or suboptimal jaundice, intake jaundice, and we've assessed the, breastfeeding, they've seen lactation, all that good stuff, and they have to start phototherapy or treatment for that, we may need to also supplement with a short-term course of formula or express breast milk while you're breastfeeding. The bottom line, if the baby is within normal weight loss range, avoiding stooling, not getting therapies for any type of low sugars or jaundice, and the baby is happy, we are going to encourage breastfeeding. We should encourage breastfeeding. If anytime there's something different than what this is, like what you see here, you might have to do a short-term supplementation, but that shouldn't be a forever thing. How to supplement. So if a physician or a medical provider ever tells you that you need to supplement your baby, always ask these questions. Why do I need to supplement? What do I need to supplement? Do you need to have an evaluation, like I said, with the lactation consultant or with a speech therapist to figure out what the root cause of the issue is? How long do I need to supplement for? How much am I going to do this? How much am I going to give and how often? We need to treat this like a medication. And that's how I usually approach this is like I'm writing a script. And so if a provider or a physician tells you that you need to supplement, just ask these questions so you know how long this is going to go on for and making sure that you fix the problem that may be around. So some other things I want to talk about really quickly because we are working more and we
Okay, it looks like Dr. Charisse might be frozen for a moment. We're going to see if we can get her back. But while we're waiting for Dr. Charisse to come back on, so before she continues with the rest of this, I do want to just circle back. Oh, Dr. Charisse, are you back?
I tried to take off the camera so it wouldn't freeze. Is it still frozen?
Nope, we can hear you. And if you need to turn your camera off for bandwidth, that's fine too.
Okay.
Thanks.
Sorry. What part did you hear me talk about the classes? No, okay, thank you. So I encourage everybody to take a breastfeeding class. You can find these classes through your OB's office. You can find them at the hospital that you're delivering at, or you can look in the community. But definitely find a breastfeeding class to teach you and make you more confident in breastfeeding, teach you how to use your pump, all that good stuff. Maternity leave. So if you can take the maximum amount of maternity leave possible that you can do financially. Of course, in our country, we should do better with parental leave. But again, we can't fix the problems in this talk. But just take as much as you can. Do not feel bad about it, because being a mom in general is a first time job on its own. And then you're breastfeeding too. That should be another counted as another full-time job. So take the time that you need. I would at least encourage 6 weeks, because you can try to, you're going to be able to recover as much as possible from the delivery process and get a good routine going. Your milk supply is going to be increasing. So I would at least try to do 6 weeks, but take as much as you financially can afford. Find support groups, whether that's in the community, whether that's online. Find your mommy groups that are breastfeeding for that back to work tips and tricks. If you are going to access WIC, they also have peer support groups that are experienced breastfeeding moms that give you advice on how to breastfeed. Contact your insurance company to figure out what breast pumps are covered and how to do that as early as possible. All insurance companies, or I would say all, majority of your insurance companies should cover your breast pump. Even some Medicaid coverage, Medicaid insurances should cover some type of breast pumps. So just check in to see if you can get coverage from that. Prepare the others. So that's your boss, your family, your colleagues, your spouse, your childcare provider. Prepare everybody for what you need from them and telling them how long you plan on breastfeeding. Making sure your boss knows that you will need pumping accommodations when you get back. And if you get pushed back about the pumping accommodations, let them know that there is a federal law that makes them require or requires them to provide a place for you to pump that's not the bathroom and that's locked and shielded from others for at least 1 year after your baby is born. So, there's things that you can do to make sure that you get the accommodations you need. Okay, so pumping. So once you go back to work, you will have to pretty much pump as much as you would have had your baby at home. So that, is about 2 to 3 hours. You'll have to find some pumping time. You don't have to worry about getting a freezer full of milk before you go back to work, okay? You're gonna need about 1 to 2 ounces per hour that you're gone. And while you're gone, you're probably gonna pump about 3 to 4 times, depending on how long your day is. Um, get used to your pump before you go back to work. Don't try to get used to it while you're there, because it definitely is different than putting your baby to breast. So get used to your pump. Get used to, the make sure that the phalanges or the parts that go onto your breast are the appropriate size. And if you need to sit with lactation to do that, go ahead and make an appointment before you go back to work to get that going. Have somebody else feed the baby a bottle if you can, because most babies don't want to take the bottle from the milk source. Okay. So they know that you have what they're used to. So if they see you trying to give them a bottle early on, they're going to try to refuse that. Worst case scenario, if your baby never takes a bottle, they will get used to it once you go back to work and they have no choice. So with my own, it definitely became very teary when he didn't want to take a bottle when I went back to work, but he definitely got used to it. And he's a big chunky baby, no problems with feeding. What else was I going to say about that? When you go back to work, you are plan to pump about 20 to 30 minutes at the minimum, but every person is different with how long it takes them to express their breast milk. Okay. All right, so this is the end of what I was going to say today. I just wanted to show all of these beautiful women breastfeeding, just to show that we do breastfeed. I wish I could show all the pictures I have, but we do breastfeed. We do jump over these hurdles that keeps us from breastfeeding, but we know it's challenging, but it's so rewarding. It is so rewarding. I will not say it's easy, but it is rewarding, and it's possible. So just try to take in all of the tidbits of information we have for you today. Ask all the questions that you have, and try to be prepared for this breastfeeding journey. Thank you so much for having me.
Thank you, Dr. Greer. And before we end your segment, do you think we can go back to the beginning of your slides? I just want to highlight some of that awesome information one more time.
Okay.
There were so many benefits, and if we could just run through those one more time.
Oh, okay. Sorry. You want the infant benefits again?
Yes.
Okay.
Do both.
decreased risk of sudden infant death syndrome by 36%, decreased risk of asthma and allergies by 40% and eczema, less complications from respiratory infections or colds.
I think we're frozen, but the decreased risk of overweight and obesity by 24% as well.
Freeze again.
Yeah, maybe we might have to cut your camera.
Or GI bugs by 64%. Enterocolitis, which is a really bad GI process, by 77%, and you get earlier discharge from the NICU. So for mommy, you have decreased risk of postpartum hemorrhaging or postpartum bleeding, fast return to pre-pregnancy weight, decreased risk of type 2 diabetes, decreased risk of obesity and metabolic syndrome, decreased risk of bleeding, your period coming back and ovulation, decreased risk of postpartum depression, and decreased risk of developing breast, ovarian, and uterine cancers. Sorry.
That was awesome. And even just ending on that note, breast cancer, ovarian cancer, uterine cancer, and also leukemia for the babies. I think that's a really big message for everyone that they can take home. So thank you, Dr. Greer.
Thank you.
We're going to transition to our next segment. I'm going to introduce our moderator for the panel, Dr. Chrislyn Washington. Dr. Chrislyn Washington is an OBGYN in the Washington, D.C. area. She is also a women's health policy expert. So thank you, Dr. Washington. I'm going to hand it over to you to take over our panel.
Thank you so much, Dr. Chelsea Cosby Morgan. I'm so excited to be here this afternoon. And thank you so much, Dr. Greer. That presentation was so informative. There was some stuff that I didn't even know about. I didn't even know about the graph. So I'm learning, and I hope everybody who's tuned in this evening is learning a lot of information as well. So I'm so excited for this panel this evening. We are joined by a number of healthcare professionals who are here to share with you today what they've experienced as healthcare providers and also for breastfeeding moms. So it's my pleasure to introduce Dr. Lauren Powell. Dr. Powell is a family medicine physician. She is also known as Dr. Lauren, the culinary doctor. She is a breastfeeding mom. Dr. Leonie Prowl. Dr. Prowl is a family medicine physician. She is a sports medicine and bariatric medicine specialist. Dr. Prowl is a breastfeeding mom as well. Jessica Parker. Jessica Parker is a doula, minister, coach, and speaker. She is a breastfeeding mom of 4. And Dr. Dixon. Dr. Dixon is a doctor of public administration, certified lactation counselor, and a certified breastfeeding specialist. She is a pumping expert and a breastfeeding mom. So thank you all for joining us this afternoon. So we'll start off with a question for you, Dr. Powell. What was the most challenging part about your breastfeeding journey, and what was the most rewarding part?
Well, thanks so much for having me, and thanks, for putting this together. I think this has been great. I wish I had something like this. I think the hardest part for me was really just figuring out what worked for me. I had breast surgery when I was in residency, and so it really affected my production. And so I was going a little crazy because I was doing all the things, right? I was putting the baby to my breast, then I was pumping, then I was still having to feed the baby because I was having kind of a low production. And, doing that every 2 hours for 24 hours a day, it just wasn't sustainable for me. And so I just really had to come up with a plan that worked for me. And I think that was the hardest part. And once I really figured out like what works, what's a realistic number of times that I can pump throughout the day, so that I can get rest, because we know that rest affects your production. I think that was like the hardest part. And then still, being able, even though I have to still supplement, but being able to provide my baby with those bottles of breast milk, it really did make me feel like good inside, that I was kind of doing the best that I could for him.
Yeah. Do any of our other panelists want to chime in on that question? Question was, what was the most challenging part of your breastfeeding journey, and what was the most rewarding part? Yes, Jessica.
I can speak to that. So I would say that the most challenging part for me was actually the support of the people around me, because I breastfed for a lot longer than anyone else in my circle had ever done it or had seen it done before. So when I got to a specific point in my breastfeeding journey, they were looking at me like in the presentation we just saw, like, that baby can hold their own bottle. Why are you still breastfeeding? Or that baby's walking and talking, So I had to look for and find a circle that was supportive of my decision to continue breastfeeding beyond what most people would consider, how long they would go. And what I would say is the most rewarding is I've been breastfeeding for the past 7 years. And I think that for me, what has been the most rewarding is that, just like some of the things that we talked about before in the presentation, some of the benefits, my children have really not been sick very much. So I would like to believe that is from breastfeeding.
Thanks for that, Jessica. And you mentioned, you have 4 kids. So how long were you breastfeeding with each of those pregnancies, knowing that each pregnancy is different, each baby is different? And how did you manage working full time and breastfeeding for so long?
So yeah, so my goal was to get to at least 2 years with each child. But what happened was basically every 2 years I got pregnant. And for me, for my body, when I became pregnant, my milk would just stop. So I managed to make it, the longest I made it was 23 months with one of my children. So going back to work was actually not that bad. I would say that I knew what my rights were, I knew what the laws were, and I prepared myself before I went. So I actually want to show this. This is the only thing that I took with me to work. So it's not this whole big thing that you have to be worried about, hauling things around. It's a backpack that I just put on, and I took that to work. I pumped when I needed to. I was communicative with my employers. They were receptive of those things, and it was a labor of love for me. So I know I wanted to breastfeed for a certain amount of time, and I put in the time and effort it took to do that.
Thank you. And so, Dr. Prowl, could you tell us some of the speed bumps that you've encountered through your breastfeeding journey?
So again, thank you everybody for listening in. For me personally, I had quite a few actually, speed bumps along the way. So personal history, I have hypertension and I've had it for quite some time, but that played a role in my pregnancy. In that, usually in the middle of pregnancy, so when you're in the second trimester, your blood pressure drops. But in that third trimester, your blood pressure usually starts to go back up again. And in fact, that's exactly what mine did. And towards the end, about 35 weeks, it started climbing a pretty good deal where my OB was worried about it. Thankfully, I didn't develop preeclampsia, which is that really elevated blood pressure after 20 weeks, which is associated with protein in your urine, can lead to strokes, can lead to seizures. But I was heading in that direction. And so because of that, my doctor made the decision that we would just go ahead and have a C-section early. So my little one, Layla, was born a month earlier than she should have been. But thankfully, she was okay. So she was born at 36 weeks. So I had a lot of those risk factors that you see for challenges with breastfeeding, being an older mom, having a C-section, having a preterm baby. So we had some difficulty with latching initially. She had some weight loss issues that required some supplementation. We pushed through all of it, but like some of the other moms said, you would think like, oh, this is going to be so easy. It's going to come so naturally. And it didn't for me. And it didn't probably for a lot of moms. And I had to put in a lot of work and talk to the lactation consultant many, many times to have them come in and say, what can we do to get this little one going? Because when babies are premature, Sometimes they don't have that reflex of sucking, swallowing, breathing all together. So it's much harder for them to latch. They get tired easy. So sometimes you got to wake them up to get them feeding again. So we just went through all of those things. Thankfully, we were able to kind of push through, and we breastfed for the entire year before stopping. But we had some hurdles in there.
Wow, thank you for sharing your experience with us. I think a lot of our viewers will find that information very reassuring that they too can be successful with breastfeeding. And so I think that's the perfect opportunity to invite Dr. Dixon into the conversation and sort of talk to us about how women can get, virtual help or help with any problems that they're experiencing with breastfeeding, whether it be, issues with trying to get the baby to latch or with decreased milk production. How can you help us, Dr. Dixon?
So I'm probably from a little bit of a different point of view. I believe that all forms of feeding is amazing. So I'm an exclusive pumper. So when my child was born, he had meconium. He pooped in the sacs. His lungs collapsed. He had to be resuscitated at birth, and he was taken immediately to the NICU. I was not told anything to do because when we are starting our journeys with breastfeeding, we're only told about nursing. And so I literally was sitting there, no child, literally not knowing what to do, not knowing that I can start hand expression, not knowing that I can start, doing other things. My husband went immediately, with my son to the NICU to birth, and I literally was in my room alone, right? So there's still another part of the journey in the story that's not always told of, you think you're going to start out with this amazing journey and things completely go left, right? And so I am here to tell everyone on this call, there are so many things that you can do if things are to happen when you are starting the process. I hope each and every person, they are able to see their dream of nursing, but we don't know what's going to happen when we get to the hospital. So I literally want to encourage each and every person, regardless if things may not go as planned, to have a plan prenatally, doing prenatal breastfeeding classes, doing classes that also promote, if things were not to go as planned. And so I literally started pumping, oh my gosh, like, separated from baby. I finally got a pump in my room maybe 2 or 3 hours later, and I just started pumping. I personally, things go left, and you are able to get a pump. Sometimes, hospitals, they gave my baby formula right away, not with my permission, of course, but, things had to happen. And so then I started pumping and continuously pumping and, had a great journey where I was able to exclusively pump, return to work, all of that. So I just wanted, just to let everyone know that there's another side. Sometimes doctors and, hospitals may go straight to formula and skip pump breast milk as a viable option. I am currently on my second journey. I'm feeding both of my boys breast milk. I'm currently almost 3 years pumping exclusively, feeding both of my children breast milk, tandem pumping for both of them. They both get breast milk from birth. My other son, I had my second son at 9 months, and so ended my journey early, like Jessica stated, where my milk supply didn't keep up. But now on my journey, almost 3 years in September. And so when things go wrong, I just want to encourage everyone to have a plan. So I believe in getting the help that you deserve from the beginning, taking charge of our journey, right? So if we have plans to nurse, let's find lactation professionals that specialize in nursing, ones that can help us with latch assessments, ones that can come to our home, do weighted feeds. If we're not getting the support that we deserve, we need to step up and step out on ourselves and use our words and our voices to be heard in this life, right? Because we are not always supported in the system. And if something were to happen at birth, I highly encourage. I am the breast pumping expert. I help women show up and breastfeed their babies if they have to be separated. It's a reality when we're returning to work that we have to be separated from our babies, and helping and making sure I do real-time pumping sessions. I do opportunities to learn how to use your breast pump. I have over 60 breast pumps behind me, either manual breast pump or double electric breast pump. I have over 60 in my possession. I have another 150 to 200 pumping products to help take the guesswork out of pumping. Some people, they have a natural, when it is natural to breastfeed, to nurse. It is not always natural to learn how to pump. They are, not seeing their supply. They may not respond well to the pump. They are not matching their baby's suction pattern or realizing what their body likes when it comes to pumping. So all of those things can be an impact. And I just highly encourage, if you are not seeking and getting the help that you deserve. So many people, their journeys are not going as long as they would want because they do not have support. They do not have the practical information, realistic information to help them to get where they need to go on their journey. And I encourage each and every person on this call to get the help that you deserve. If you are not able, if you have issues with latching, concerns there, if you're having concerns with your pump, if you're having concerns with decreased supply, if you're having concerns with your hormone levels, so you can pump or nurse all you want, but there's a secondary part if there are any underlying conditions at play. You can get the help that you deserve by seeing a doctor, getting your prolactin levels checked, getting your thyroid checked, getting your iron levels checked. Certain things in your hormones also play a factor in making sure that you can breastfeed effectively, either by nursing and or pumping.
Wow, thank you so much for that information. That's so powerful. And talking about giving your baby breast milk, it's also important in what we put into our bodies as well, right? So, Dr. Powell, as a nutrition expert, what should women be eating to be successful with breastfeeding and pumping?
I think the most important thing is definitely your hydration status. Like, if you're not, I mean, if you just think about it, it's, what we're putting in is what's coming out. So you have to stay more than hydrated. I feel like part of what makes breastfeeding and breast pumping such a full-time job is staying hydrated. You are literally drinking all the time. So water over anything. I find like quality proteins and quality carbohydrates are also helpful. Sometimes it's hard because we kind of want to, get a little strict with our diet right after, having a baby. But I think it's important that we give ourselves grace and we're gentle with ourselves. Having some quality carbohydrates, I think, is important. Again, the high quality protein as well. But that hydration status over anything.
Thank you. And so, Jessica, you're a doula. So I think I would like you to explain sort of what is a doula and how is it different than a lactation professional, and how can a doula help in a women's breastfeeding journey?
Yes. So a doula is someone who provides emotional, physical, informational, and support, as well as advocacy and collaboration. And so all of those big words mean a doula is someone who will empower you to make the best decision for you and your family. That's just in a nutshell. And what I would say is, the difference between a doula and a lactation consultant. So unless a doula has gone through the actual certification process to become a lactation consultant, what we're able to offer is breastfeeding support. And breastfeeding, that's one thing I want to say very quickly. We have to change the language around the things that we talk about, right? If we want people to feel encouraged and empowered and supported, we've got to change our language. When we say breastfeeding, that is any milk that comes from your body. Breastfeeding does not mean only nursing. Breastfeeding does not mean only a bottle or only pumping. It is all of those things. Breastfeeding is feeding your baby. So I think that's one of the first things I just have to throw out there first. So aside from that, though, to talk about the differences. So a lactation consultant is someone who is trained to provide that intensive type of support. Whereas a doula, we can help you work on your latch. We can help you with a pump if we're familiar with it. That's where someone like Dr. Dixon will come in and can help you with something like that. And we can help you find resources if there is something more intensive than we're able to help you with. What was the last part of the question?
And how can a doula help you in the process of their people's breast milk journey? So I think you kind of covered that a little bit.
Yes. So honestly, I would even say just being there and having somebody to talk to helps a whole lot, because like I said, even with my own journey at the beginning, I just didn't have the support. And perhaps it wouldn't have been such a struggle for me if I'd had someone else who could even just listen to what I was saying and would validate what I was saying, right? Because when I would come to some people with some of my concerns, they'd be like, well, just give them formula, so something like that. So also, doulas are a huge source of resources that can point you in the right direction for the different issues that you may be experiencing or any challenges that you're experiencing, um, even down to things like if you are showing signs of things like postpartum depression or things like that, just being able to recognize those things and point you in the right direction. That is where a postpartum doula can come in to help as well. There's different types of doulas. So even as a doula myself, I've had both a birth doula and a postpartum doula because they're awesome.
One thing, if I could just add about the hydration status, I was just thinking one quick way for people, because there was like, I don't know if I'm drinking enough water. When you use the bathroom, you're like, it should be clear, right? Like you should use the bathroom and say, did I pee or not? Because like my pee is the same color as the water. That's an easy, like little quick trick. One thing I would do is right before either pumping or feeding, I would try to chug a 16-ounce bottle of water and then drink another 16-ounce between the sessions. So again, full-time job. I know it's like another thing to do, but just something to make it easy for people.
Thanks. Going back to Dr. Prowl, you mentioned that your baby had difficulty latching. Could you tell us how you took action to address that?
Yeah. So when my little one was born, and just looping back, she was a little bit early, so premature. So she also had an issue that premature babies have, which is jaundice. So she was a little bit yellow. And because of that, she required phototherapy. So all of this builds into barriers, kind of challenges with breastfeeding. But because of the jaundice, her weight dropped more than the doctors liked. So the supplementation came up because I wasn't fully making all of that breast milk yet. It was just the colostrum. But with her large weight loss, we needed to do something. And so I would throw that out there and say, everybody usually wants to like stay with the breast, stay with the breast, stay with the breast. But if your baby needs it, we usually try to say like a fed baby is like the best thing. So ultimately you just want to feed your baby. And so we had to supplement in the short term. Thankfully, we were able to, as my milk came in and I'm pumping more to try to go with things, I was able to transition her off of the formula, but we definitely had to use it in the beginning to kind of get her where she needed to be. Another barrier or difficulty that we had is that she had a tongue tie. She also had a lip tie. So she had a little piece of tissue attached to her tongue, as well as another piece of tissue attached to her upper lip, to her top part of her gums. So it basically makes it difficult for her mouth to kind of flange open to kind of get around that breast, and her tongue really wouldn't come up to help her suck properly. So we had to get that addressed. And so that we got that fixed within the first week. We got that clipped, and then getting that to heal. So we had to get over those things too. So all of this to say that I feel like I had many of those challenges that people mention about this didn't go well, this didn't go well. You're like, why isn't she latching? Like, I'm doing everything that you tell me to do. And then you're like, oh, she also has a lip tie and a tongue tie. But we got those things fixed. But it's just with the encouragement to say, just try to keep going. I'm just going to reiterate, like, so many times I went into it thinking that the breastfeeding was going to be a breeze, that it was going to just come naturally to me. And that was not the case at all. And so just having that in the back of your head, that if you are struggling a little bit, that you're not alone, that you're not some zebra amongst horses, that it is very common, and to reach out and try to get the help that you need.
Thank you. And I have a question for Dr. Dixon. As an OB, I always get moms or new moms asking, what breast pump do I buy? And so what advice can you give to moms who are looking to purchase a new breast pump?
First and foremost, I want to say and scream from the top of the hills that there's no such thing as the best breast pump. The best breast pump is the best breast pump for you. And you have to know what that is and what that looks like. It starts out with your insurance options, right? People get a list of insurance options if you have insurance, and you can get those lists of options, right? just picking a breast pump is not the best. Just asking your girlfriend down the street or your coworker or XYZ, all they can tell you is what works best for them. They cannot tell you what works best overall. I highly encourage you to get a list of your breast pumps. If a pump can be customizable, that is where I like to start. What I call a workhorse pump, a pump that you can make go faster, slower, stronger, weaker. If you are using a pump and you can only go up and down, you will never ever find out what your body likes. You will never ever be able to mimic your baby nursing. All you can do is choose the up and down buttons that are on your pump. So making sure that you are choosing a pump that can be customizable, a pump that may have different cycles to start out with. If you are able to do different functions, then you are able to produce milk in a better way that can respond best to your body. I hate the flyers that are online that tell you numbers to press buttons with, because that is not telling you what your body likes. You have to get in tune with your body. And this may be a little TMI, but we out here today and I'm gonna give you the real Holyfield, because you're talking to Pump with Purpose. Your body will tell you exactly what it likes, right? We had babies, so we know what our body likes, right? You're not going to like pumping and stuff like you like other things that your body likes. But trust and believe your body tells you what it likes. If you are in a pump setting and you are starting to see all this milk start flowing out, pay attention to that. Watch when you are using pump if your body is responding well to it. And then that can help you to be able to know what your body responds best to. No flyer online will ever be able to tell you that. Your girlfriend down the street will not be able to tell you that, right? I have 60 pumps behind me. They all do different things. So just picking a breast pump on the street, on the fly, you can waste your money. And don't think that just because a pump is free, oh, I get a pass, because then you honestly may have to go buy another one because your body isn't responding well to it. You won't know until you start to use a pump. So I really like to have what I call primary pumps and secondary pumps. Primary pumps are your workhorse pumps that can get milk and extract milk at different cycles and different speeds. Then you have your secondary pumps that may be your normal pumps that you walk around. They're small, cute little pumps. That doesn't mean that's your workhorse pump that's going to get that milk out for you. That just means I need to do this on convenient because I don't want to carry around something that's huge, right? Then you have your wearable pumps that everybody's loving these days. Please understand and know that wearable pumps may not empty the breast as well as a traditional flange. I don't know why. They are for convenience. You need to run out, you want to pop up something in your breast, but when you return home, always pull up to the traditional pump. There are people that are just using wearable pumps as your primary pump. I scream for the hilltops and highly discourage that option, and I'm going to tell you why. In the first 12 weeks, your milk supply is hormonal. That means that if you demand that milk, the milk will come. After 12 weeks, your body changes to supply and demand. So you have to pull up to a pump at a regular basis or nurse. Either way, you're nursing or pumping, it does not matter. Your milk supply is hormonal. So if I can get people in the first 12 weeks to get their milk supply where it needs to be, if you're having any concerns with your baby latching, if you're having any concerns with feeling like you don't have enough milk, you may need to introduce the pump sooner rather than later, because you don't know what your milk supply will do until your milk supply does it. So if you don't get, people are telling people to introduce the pump at 10 to 12 weeks right before they go back to work. I personally feel, and I recommend to my clients, that they need to possibly introduce the pump earlier if they are seeing signs that their body is not producing milk in the way that they would need to. Because again, if there are latching issues, both of my sons were tongue tied and lip tied. My youngest was buckle tied as well. He was not removing milk from me. I was literally trying to latch, coming unlatched. So please understand, getting the care and watching what you are, what you feel like your milk supply is doing. Some people think they have low supply and they honestly don't. They just haven't encouraged certain ways to get the milk out by using a pump that is effective. So I highly encourage, if you are showing concerns, don't wait until right before you go back to work, because sometimes people think that they're magically going to pull up to the pump and they're going to just like have oodles of milk coming out. Sometimes what we do in the first 12 weeks what happens when milk supply regulates. At 12 weeks, it regulates and it becomes supply and demand. So sometimes I have to put people on a more aggressive schedule after 12 weeks when they're going back to work, or, being separated from their baby more, want to get away a little bit more, want to run to the store, or want to hang out with your friends. All of those things, you have to have a consistent schedule to be able to pump. Matching what your baby is doing, matching how your baby is feeding is also very, very important. But I firmly believe that if people can introduce the pump in a way that works well for their goals, I personally do not believe anyone needs a freezer full of milk. But if it is your goal, I knew I wanted an oversupply. I help people reach their goals, whatever that looks like. So many people are shamed if they do want a freezer full of milk. That is not always possible, but you have to reach and set goals for yourself. And finding professionals that will help you to reach those goals is what is important. If you are having issues early on, identifying those issues and getting the help that you deserve. Taking control of our journey is the most important thing we can do as Black women. We have to speak up for ourselves and let people know that we want certain things. The system is not set up for us to do well all the time, right? We have to find lactation professionals, doulas, doctors that can help us to reach our goals in whatever way that looks like, because how we choose to feed our baby will look different person to person.
Right. And so, kind of going into our final question for the evening, my sister just had a baby 7 months ago. One of my close college friends just had a baby a little over a month ago. What is the number one thing your village or circle can do to support you in your breast milk journey? We'll start with Dr. Powell.
I think asking that question, like, what can I do to support you? Because again, it's going to look different for different people. I had a lot of I had breast surgery. And so I just had a lot of difficulties with breastfeeding from the beginning, and having friends literally come over and hold my boob while someone held the baby, just kind of really got in there with me, meant everything, because it's such an emotional journey, and you want to be able to do the best for your baby. Having friends come over and just wash bottles and wash parts and disinfect stuff, that meant the world. And someone said bringing food, making sure I have nourishing things to eat, and that I'm supporting my body well. I just, I think this has been great. I think this information is great. I think talking about pumping also has been great, because I basically exclusively pump at this point. I think we just have to remember to do what works for you. And there's so much pressure that we have to do stuff a certain way, or we're like not doing a good job. And that's what I felt a lot. I know for some people, I had a friend who was making all the breast milk in the world, but breastfeeding and pumping was so anxiety provoking for her. She wasn't sleeping well, and then she was staying, so she had to cut back on breastfeeding and on breast pumping, because it just brought so much anxiety for her. And I was the opposite. I desired everything in the world to be able to, make enough milk for my baby. But you have to do what works best for you. And whatever you do that's best for you is good. Like, that's good. And I think it's always important. I know I loved hearing it. And I always tell moms when I meet them and I'm talking to them, as I tell them, you're doing a good job. Because I think they can never hear that enough. Whatever you do, you're doing a good job.
That's great affirmation. Dr. Prowl?
I would echo, I was thinking the exact same thing about giving the kudos to mom to say that you're doing a good job, because when you're exhausted, being up all night, and, you just sometimes you just feel like you're just not good enough and you're not doing it right. And just somebody coming in and just giving you a pat on the back and that reaffirmation, you're doing great, I love what you're doing, is always helpful. I think for me, having a family and extended family and friends that weren't breast phobic, for lack of a better word, was also really helpful. So if I'm sitting in the living room and baby's hungry, I don't have to run to a room upstairs to breastfeed. That everybody gets that I'm just feeding the baby, and it's not a gross thing. It's not a sexual thing. It's I'm feeding this baby, and that's what it is. And I think that was very helpful, in having that support to say we're all here supporting you breastfeeding this baby. Um, and then just give yourself some grace that sometimes things won't go how you plan. If you have to supplement, you have to supplement. Um, and just do what's best for you. Ultimately, you just want to feed that baby. And if that means that you're not getting it directly from the breast, that's fine. If you're exclusively pumping, that's fine. If you have to supplement, that's okay too. Just treat yourself with grace.
I like that, grace. Jessica?
I would say if you know someone who is breastfeeding, even if they've been doing it for a while, just ask them what they might need. A lot of people don't always speak up for themselves, or they will speak up if they're asked. I would say for anyone who is out there who is breastfeeding, make sure you're asking questions and expressing what you need as well. I do want to say very quickly that one of the things that really helped me with my breastfeeding journey, and I think, and I'm saying this because this will be great for someone who's in someone's village or circle as a gift, is these freezer bags. You can put these into the freezer, and it's a great way to support your maybe going back to work, or if you are pumping for any reason at all, because it'll help keep your milk cold. I would also say if you have a pump that is electric, get yourself a car charger, because I cannot tell you how many times I have been driving up and down the highway pumping. And like Dr. Dixon said, those wearable ones don't always get the job done, but hooking up, driving up 95 can get that, can help you with that milk. It's true. It's true.
Dr. Dixon?
I think that our partners, our families, can be the most supportive people in our circle, right? Our partners giving them the opportunity to show up, and we don't may not always can express exactly what we want because our hormones can be all over the place, and we could want something and not know how to express it. But I think that having partners that and not comparing our partners to other people, right? Mm-hmm. So knowing that, like my husband, he don't watch no parts. I did a joke and had him on Instagram and was like, put my pump together. I've been pumping for 4 years combined almost between the two, right? My first journey was 9 months and this journey is almost 3 years. And he doesn't know how to put a pump together. He's never watched the pump part. Didn't get up in the middle of the night. Like, well, my husband is amazing. Like he shows up and everyone in their partner, sometimes we compare to other people, or like this husband does this or this partner does this. Like no, like whatever way, like he has the kids right now, he's out there, or they do basement Fridays and he takes them downstairs. Like whatever way it looks like in your household, celebrate in that moment for your family. Like my mom, like she knows I'm so exhausted, and they think they're helping us when they're like, listen, just do, because sometimes culturally know how to be there, right? And I'm like, Mom, that's not what I need right now. I need you to just be like, you good? I need you to just tell me, like, I don't need you to say, well, how is it now? She's like, how is it going? And now that I've turned this into a whole thing, my family is there and they're watching. My uncles are watching. Like, they're like, this is interesting. I never knew, people struggle and people have issues, and finding people to help you to reach your goals is what it's all about, in a way that works for you. No mom guilt, no mom shame. I tried for months and months and months, even after getting the ties release, and pumping worked well for me. Pumping was a viable solution, and I've created a space for people to feel welcome. Now, a lot of my clients now, they nurse and pump, because getting the help that they deserve as well to add pumping to their journey, because in life, we got to be on the go. And I just feel like having the support in whatever that looks like is a way to help us to reach our goals, no matter where we are in our journey. So I just encourage us to speak our truth, whatever way that looks like for us. Tell the world that this is what we do. We are shamed. Like, don't speak about it, don't talk about it. Or if you happen to do well with nursing and pumping, like being ashamed to, like, oh, I don't want to, I've created a space that people can exist in sadness and happiness and own it, right? We have a good day, bad day, sad day, mad day. Speak it, own it, and bring our circle in to let us know how we feel, so we can show up and be the best parent for our child that we can be. And we as Black women don't always say that this is hard. I can't be everything for everybody. Mm-hmm. Like, I'm tired. Like, we have to show up in our genuine, authentic self. We don't got to carry the world on our shoulders all the time. We don't have to do that. And I'm speaking to myself when I'm saying it as well. Like, I want us to be the best version of ourselves and tell the world we don't have to be everything for everyone. We need help. We need to speak on it. We need assistance. We need to speak on it and just let people be there for us. So it's also our job to like let down those strong barriers and say, I need help. I need someone to take this baby, to let me get some sleep, to let me eat a meal, right? I need this. And we have to show up for our partners, let them know what we need, our families, our circle, our village, our neighbors. We cannot do it all. And if that comes to having to take a moment for ourselves, that's okay. And I just really encourage everyone on this call to show up as your authentic self and to speak our truth, no matter if it's hard, no matter if it hurts, because mental health is so important in this space. It's not talked about. People are driving themselves to postpartum depression and anxiety trying to feed their baby due to this formula shortage, due to trying to show up and do what they're supposed to do, right? Like, let's be there for them in this moment. And it is hard. It is not easy. And I encourage you to get the help that you deserve early on in the process to help you to get where you need to go.
That was a word. Thank you so much, Dixon. And Dr. Greer.
I would agree with whatever everybody else said. Everything I agree with. I'm just shaking my head. Preach. I think, no, you don't really know what you need and want until you're going through it. So just be okay with that. Like, especially with our personalities, we want to control everything and we want to plan for everything. And you really don't know what that looks like until you're going through it. But I think the one thing that was very helpful for me, especially with, family members not understanding how breastfeeding works. And they're like, oh, but I want to feed the baby, but I want to do this and I want to let you get sleep. And I was like, but I can't sleep, right? Because I got to feed the baby. So it's just letting go of that, the thoughts that I had about what this was supposed to look like. And also in my head, knowing, like Dr. Dixon said, knowing when people said I was supposed to start pumping, but also knowing that I wanted to sleep a little longer during this time. I accepted that for me, pumping earlier was easier. Like, so I pumped once a day, at least in the mornings, right before my morning feed. I mean, right after my morning feed. So somebody else that was in that house could feed my daughter and I can get a little longer stretch of sleep. And I encourage anybody that has all these family members that come and you're breastfeeding and they feel like they can't do anything other than bringing meals and all that stuff, put them to work. I had my family all sit around looking at me breastfeeding. I'm like, y'all not doing anything. Like, y'all all just here looking at me. So I said, okay, you're going to take the 12 to 4 shift. You're going to take the 4 to 8 shift. And I'm just going to try to sleep a little longer, something like that. So it helped my planning personality be planned. And it also helped me sleep a little longer for my sanity. And it helped people feel like they were being helpful. So I think people actually enjoyed that, because then when my son came along, they were asking when their shifts were, So I would just encourage, if you have the abilities to do that, just put people to work. If that's not cooking, if it's not cleaning, maybe giving them a bottle, let the baby sleep a little longer, whatever you need, just be honest with that. My husband filled up the water, just making sure I could drink, like Dr. Lauren was saying. Gave me snacks, so anything that you don't have to do, have somebody else do it. Let it go. You don't have to be superwoman during this time, because it's already 3 jobs you've taken on, working full time, feeding your baby and being a mom. So you can let some of the other things go.
Well, thank you all so much. This has been awesome. Thank you to Dr. Washington for moderating, Dr. Powell, Dr. Prow, Jessica Parker, Dr. Dixon, Dr. Greer. Thank you. Thank you to the NMA for sponsoring and helping us create this event. And if you didn't take anything else out of this event, It's that Black women need support. We need support at work. We need support at home. We need support everywhere so that we can breastfeed and be embraced during this journey. And we're not just doing it for ourselves. If something is going to reduce childhood cancer, leukemia by 20%, we're always worried about breast cancer. It can reduce breast cancer, reduce ovarian cancer. This is a no-brainer, but we can't do it alone. So thank you all for joining. And we do have resources from these phenomenal women, and we will be emailing those out. And also, we're going to have the recording available for people as well via email. So thank you again, and have a good night.